High blood pressure is often called the silent killer for a reason. It usually doesn't cause pain or show clear signs. Many older adults don't realize they have it until something serious happens, like a stroke or a heart attack. What makes it even more dangerous is how easy it is to overlook the daily habits that raise your blood pressure. Every day, the choices you make, what you eat, how much you move, how you handle stress, affect your blood pressure more than you might think. Many people over 50 think they're doing the right things. They take their medicine, go for checkups, and try to stay active. But small, unnoticed habits can still be working against them. These habits might seem harmless, but over time, they can raise your blood pressure or stop your treatment from working properly. And unless someone points them out, they continue silently, putting stress on your heart, brain, and blood vessels. That's why this video is important. We're not here to confuse you with medical terms or make you feel bad. We're here to give you clear, simple tips that can truly help. We'll talk about the most common blood pressure mistakes older adults make and how to fix them. Whether you've been dealing with high blood pressure for years or you're just getting started, this guide will help you feel more in control, confident, and encouraged. Managing your blood pressure is about more than numbers. It's about staying healthy, thinking clearly, sleeping better, and enjoying life. And it all begins with learning what to avoid and what to do instead. So let's look at the first common mistake and start building better habits for a healthier heart. Mistake 1. Skipping your medicine or not taking it the right way. For most people, managing blood pressure begins with medication. These medicines work well, but only if taken the right way and every day. A common and risky mistake among seniors is missing doses, taking pills at the wrong time, or stopping the medicine without talking to a doctor. It may not seem like a big deal, but it can be very dangerous over time. People skip doses for many reasons. Some forget, others feel okay and think they don't need the pills. Some worry about side effects or don't like depending on medicine. Others try to save money by cutting pills in half or taking them every other day. These choices might seem reasonable, but they can cause your blood pressure to go up and down dangerously. That puts pressure on your heart and raises the risk of stroke, kidney problems, or heart failure. Blood pressure medicine is designed to protect your whole body, not just lower a number. When you skip or take it wrongly, your blood pressure can rise without warning, and because there are usually no symptoms, you might not notice until a crisis happens. Also, these medicines don't make you feel better like painkillers might, so it's easy to forget how important they are. But they are working behind the scenes, reducing pressure on your heart, improving blood flow, and lowering your risk of serious health problems. The good news? This mistake is easy to fix. Make your medication part of your daily routine. Take it at the same time each day. Use pill boxes, phone alarms, or checklists to remind you. If you ever forget to take your blood pressure medicine, don't try to make up for it by taking 2 doses. Instead, call your doctor and ask what to do. And if the medicine is giving you side effects, speak up. There are often other options or adjusted doses that can work better for you without risking your heart. Also, don't stop taking your medication just because your numbers look good. That usually means the medicine is working, not that you're cured. Always check with your doctor before making any changes, even small ones. Changing the time you take it or how much you take can affect how well it works. If cost is a problem, talk to your doctor about it. Some people try to make their medicine last longer by taking less, but that can be dangerous. There are often cheaper versions, discounts, or programs that can help. Your health is worth having that conversation. Managing your blood pressure is a long-term effort, but it can lead to more energy, better stability, and peace of mind. And it all begins with staying consistent. 1 pill, 1 day, 1 choice at a time. Your heart depends on it, and so does your future. Mistake 2. Eating too much hidden salt. You might think you're avoiding salt just because you're not adding it to your food. But the truth is, most of the salt you eat is already in the food, even if it doesn't taste salty. A common mistake people make is not realizing how much sodium is hiding in everyday meals. Eating too much sodium raises your blood pressure because it causes your body to hold on to water. This extra fluid increases the amount of blood in your system, which puts more pressure on your blood vessels. Over time, that pressure wears out your heart and raises the risk of stroke, heart attack, kidney problems, and more. But because you don't feel it happening, it's easy to ignore. Salt is often hidden in packaged and processed foods, like canned soups, sauces, frozen dinners, breads, deli meats, and even things that seem healthy, like low-fat dressings or whole grain crackers. Salt isn't just added for flavor. It helps preserve food and make it taste better. And when you eat these foods often because they're quick and familiar, the sodium builds up fast. For older adults, this is especially important to watch. As we get older, our kidneys don't remove sodium from our bodies as well as they used to. Our bodies also become more sensitive to sodium, meaning even a small amount can raise our blood pressure more than it would have when we were younger. It can also cause fluid to build up in the body, which can lead to swollen legs or make heart conditions worse. The first step to fixing this issue is awareness. Start reading food labels, not just for calories or fat, but also for sodium. You'll be surprised how much is hidden in everyday items. 1 can of soup can have over half your daily sodium limit. Even bread or cereal can add up if eaten often. Choose items labeled low sodium, less than 140 milligrams per serving, or no added salt. You can also take simple steps at home, like rinsing canned beans and veggies to remove extra salt. Go for fresh or frozen foods without added sauces. Cooking at home gives you full control over what goes into your food. To make meals tasty without salt, try using herbs, spices, lemon, vinegar, garlic, or pepper. These add flavor and protect your heart. It might take time to adjust if you use a salty food, but your taste buds will change. Soon, you'll start enjoying the real taste of food and may find salty foods too strong. Within weeks, you'll notice that natural flavors stand out more. Lowering salt doesn't mean boring meals. It means making choices that help your heart, give you more energy, and keep your body balanced. Every meal becomes a chance to support your health, not just fill your stomach. Mistake 3. Not checking blood pressure regularly. High blood pressure often has no symptoms until it's very serious. That's what makes it dangerous. You can feel fine while your blood pressure quietly goes up. Many older adults make the mistake of only checking their blood pressure during annual doctor visits. But that's not enough. Blood pressure changes all the time based on stress, sleep, food, or activity. A single reading at the doctor's office doesn't show the full picture. In fact, those readings can be off, higher because of stress or lower because you're relaxed that day. That's why checking your blood pressure at home is so helpful. It shows your patterns over time and can even save your life. Without regular checks, you might not notice if your medicine stops working or if something in your diet or lifestyle is affecting you. Maybe a new supplement is clashing with your prescription. Maybe a stressful event is affecting your numbers. If you're not tracking it, you're just guessing. And guessing isn't good enough when it comes to your heart. Monitoring at home is simple and gives you power over your health. You'll spot problems early and give your doctor helpful information. This puts you in control, not just waiting for results, but actively working toward better ones. You don't need anything fancy. Home monitors today are easy to use, affordable, and have big displays and memory storage. Just be consistent. Take your reading at the same time each day, like in the morning or evening. Sit quietly for 5 minutes before you check it and rest your arm on a table. Keep both feet flat on the ground and remain silent while taking your blood pressure. Doing this daily helps give you a consistent and accurate view of how your body is doing. It's also helpful to keep track of your readings, whether in a notebook or with a mobile app, and bring that record to every doctor's appointment. This makes your visits more effective, allowing your doctor to spot trends, adjust medications, or catch issues early before they become serious. Some people avoid checking their blood pressure because they fear what they might see. They think high readings will only add stress. But ignoring your blood pressure doesn't protect you. It actually gives any potential problems time to grow unnoticed. The first step to improving your health is being aware. With blood pressure, catching changes early can make all the difference. Taking your blood pressure isn't just a chore to check off. It's like having an ongoing conversation with your body. And just like good conversations, it works best when it happens often, calmly, and with care. Make it a daily routine. Make it a habit. Most importantly, treat it as a priority, because the choices you make today shape your health tomorrow. Another common mistake is ignoring stress. Stress isn't just something we feel mentally. It affects the entire body. While poor diet and lack of exercise are well-known triggers of high blood pressure, chronic stress is often overlooked. For older adults, unaddressed stress can lead to sleep issues, low mood, and a steady rise in blood pressure. When you're stressed, your body releases hormones like adrenaline and cortisol. These cause your blood vessels to tighten and your heart rate to rise, normal reactions in the short term. But if stress becomes constant, your body stays in this high alert state. Blood vessels stay tight, your heart works harder, and the pressure builds over time, causing damage that medication alone might not fix. Stress isn't always obvious. It can show up as tight shoulders, a heavy chest, poor sleep, or simply feeling worn out. Many seniors were raised to stay strong and push through, so it's easy to ignore these signs. But ignoring stress doesn't make it disappear. It just allows it to quietly weigh you down, drain your energy, and raise your blood pressure. The good news is that stress relief doesn't require anything extreme. Simple, intentional actions can calm your system and restore balance. Deep breathing helps slow your heart and relax your body. Gentle activities like walking, yoga, or stretching ease tension and boost your mood. Spending time outdoors, listening to calming music, praying, journaling, or simply talking to a friend can all help reset your body's stress response. The key is not to wait for stress to explode before dealing with it. Create daily habits that help you stay calm and balanced. Your mind and body need regular space to relax, and doing this consistently will support your overall health and blood pressure. Think of managing stress like brushing your teeth. It's not just for when something feels wrong. It's for preventing issues before they start. And if you've been under stress for a long time, don't be hard on yourself. This isn't about blaming. It's about seeing where things can improve and taking one small step at a time. You don't have to fix everything in a day. But once you start making time for calm, reflection, and self-care, your body responds. It shows up not just in your mood, but in your sleep, digestion, and blood pressure. Stress might be invisible, but its impact is real. And you always have the power to take control, one breath, one walk, one peaceful moment at a time. Another common mistake is not moving enough. When it comes to high blood pressure, what you don't do can matter just as much as what you do. Many seniors spend too much time sitting and not enough time being active, believing that rest is always the best option. While rest is important, too much of it without movement can slowly raise your blood pressure. Physical activity helps your heart get stronger so it can pump blood more easily, which puts less strain on your arteries and helps keep your numbers in a healthy range. Exercise also improves blood flow, lowers inflammation, helps manage weight, and reduces stress. All things are great for your heart. But when movement disappears from daily life, the body loses strength and pressure builds up in your blood vessels. For many older adults, the problem isn't laziness, it's worry. Concerns about pain, tiredness, or falling can make exercise feel scary. But the good news is, it doesn't have to be intense. Light, regular movement is still powerful. Walking, stretching, or doing gentle chair exercises can get your blood flowing and support your heart. Even standing up every 30 to 60 minutes if you've been sitting for a while can help. March in place, walk to the kitchen, roll your shoulders, or tap your toes. These small actions break up long sitting periods and prevent stiffness that can raise blood pressure. What matters most is being consistent. Regular movement tells your body you're still active and capable. It boosts your heart, supports your brain, and builds confidence. The key is finding activities you enjoy, like dancing, gardening, water aerobics, or simply stretching in the morning sun. When movement feels good, you'll want to keep doing it. Over time, it becomes a habit, and your body begins to thrive. If you're not sure how to begin, ask your doctor or a physical therapist for advice on safe exercises that match your current abilities. Remember, this isn't about training like an athlete. It's about staying strong, steady, and independent. Ignoring physical inactivity might seem harmless, but it adds pressure to your heart over time. Movement truly is medicine. Every step you take brings you closer to better health and a more confident version of yourself. Now let's talk about another mistake: consuming too much caffeine or alcohol. A cup of coffee in the morning or a glass of wine at dinner might feel harmless or even comforting. But for seniors managing high blood pressure, too much of either can quietly make things worse. These substances can raise blood pressure, affect how medications work, and create more problems than they solve. Caffeine, for example, is found in coffee, tea, soft drinks, energy drinks, and even chocolate. It's a stimulant. It tightens your blood vessels and speeds up your heart rate, both of which can temporarily increase your blood pressure. For some people, this might not cause much trouble, but for others, especially those with high blood pressure or sensitivity to caffeine, even a small amount can push your numbers dangerously high. The tricky part is that caffeine affects everyone differently, so it's important to understand how your own body reacts. Some older adults can enjoy a daily cup of coffee with no problem, but for others, it can cause their blood pressure to spike for hours, sometimes without them even knowing. That's why it's important to pay attention. If you regularly drink coffee, tea, or soda, try checking your blood pressure before and after to see how your body reacts. If you notice your numbers going up, or if you feel jittery, get headaches, or have a racing heartbeat, it might be time to cut back or try decaf. You don't have to give up your favorite habits completely. Just make small, smart changes that protect your heart. Alcohol brings different concerns. While a small drink might help you relax, larger or more frequent amounts can raise your blood pressure and interfere with your medications. It can also cause dehydration, poor sleep, weight gain, and more emotional stress, all of which can negatively impact blood pressure. As we age, the body breaks down alcohol more slowly, which means the effects last longer and can hit harder. Having more than one drink a day may shift alcohol from an occasional treat to a daily risk. And combining alcohol with medication can lead to dizziness, confusion, or liver problems. These dangers grow when other medications are involved, which is common for older adults managing different health issues. The good news is that even cutting back a little on caffeine or alcohol can make a big difference. You may see lower blood pressure, better sleep, more stable energy, and clearer focus. In some cases, reducing these drinks might even mean needing fewer medications. And giving up coffee or wine doesn't mean giving up comfort. You can enjoy herbal teas like chamomile or mint, sip warm lemon water, or make your own fruit-infused sparkling water. These can give you the same relaxing feel without the side effects. This isn't about strict rules. It's about making smart choices. When you understand how caffeine and alcohol affect your body, you can make decisions that help you feel better and live longer. Your heart doesn't need perfection. It just needs care. Every small choice you make toward balance brings you closer to better health. Another mistake many people make is not keeping in touch with their doctors. Managing high blood pressure isn't just about taking pills or eating right. You need to support your healthcare provider, and open, honest communication is key. One common mistake among seniors is avoiding conversations with their doctor. This might mean skipping checkups, not mentioning symptoms, or assuming everything is fine. But blood pressure isn't something you set and forget. It changes based on stress, sleep, activity, medications, and even the weather. If your doctor doesn't know what's going on day to day, they can't make the best decision for your care. Some people stay quiet because they don't want to seem difficult or bothersome. But no concern is too small. Whether it's dizziness, side effects, a new supplement, or a change in routine, it's all important information. One issue that often goes unreported is side effects from medication. Some people stop taking their medicine without saying a word because they feel off, but this can lead to serious complications. A quick chat with your doctor could lead to a better option, a smaller dose, or a helpful lifestyle change. You should also share your home blood pressure readings. Bring your log to your appointments or use an online patient portal. Seeing a pattern over time, not just one reading, helps your provider understand what's really going on. If your numbers are all over the place, they can help you figure out why. Mental and emotional health are also part of the picture. Stress, loneliness, anxiety, and depression can all affect your blood pressure. Your doctor may be able to connect you with counselors, support groups, or local programs. And if it's hard to visit the clinic due to mobility, distance, or transportation, ask about telehealth. Many doctors now offer online appointments. Good communication doesn't need to be long. It just needs to be honest. Your doctor is there to help, not judge. The more they know, the better they can support you. And you don't have to wait until your next visit. If something feels off, if you're unsure about a reading or a side effect, reach out. Taking care of your health is a team effort. Staying in touch with your care team is one of the smartest things you can do for your blood pressure and your overall well-being. Managing high blood pressure doesn't have to be overwhelming. You don't need to live perfectly or follow a long list of rules. What you really need is awareness. Awareness of your habits, your body signals, and the small choices that add up over time. Your blood pressure isn't just a number. It reflects how you live, rest, move, and handle life. Now you know the 7 common mistakes many people make without realizing it. And more importantly, you've learned how to avoid them. From watching your sodium and managing stress, to staying active, communicating with your doctor, and being mindful of caffeine and alcohol, these are all practical changes. You don't have to do everything at once. Just be consistent and intentional. At Elderly Health Tips, we believe that good health is built one habit at a time. Choose one area to start. Maybe it's checking your blood pressure daily. Maybe it's swapping a salty snack for a fresh one, or setting a reminder for your meds, or finally calling your doctor about something that's been bothering you. Whatever small step you take today is a step toward a healthier heart, more energy, and a stronger future. If you found this video helpful, give a thumbs up, subscribe to Elderly Health Tips, and share with someone who might benefit from a little encouragement. Because when we help each other, we all grow stronger, one heartbeat at a time.